Systemic execution. How BC's institutions kill with calculated indifference. Every system that was supposed to protect us has failed. The tragedy of its flawed design. The toxic drug crisis isn't just a public health emergency. It is a relentless, unflinching indictment of every institutional system built to serve people, especially those deemed least worthy. This isn't a chain of unfortunate events or glitches in an otherwise functioning machine. No, it's a calculated, cold-blooded outcome, born from willful ignorance, state-sanctioned abandonment, and policies explicitly engineered to manage our suffering, our poverty, and our trauma, not to heal or end them. Make no mistake, I'm not speaking from some distant academic perch. I've lived this crisis. I've buried friends who should still be alive. I've seen systems, healthcare, social services, housing, and justice walk past people dying in hospital hallways like they were ghosts. This crisis wasn't born out of failure or chance. It was built into the design, a strategy of neglect baked into the DNA of every institution claiming to protect us. The toxic drug crisis in British Columbia is the intentional result of choices made by those in power. People who understood the human cost and turned their backs anyways. They didn't just forget us, they targeted us. They crafted policies to punish pain, criminalize survival, and erase certain lives. Poor lives, Indigenous lives, lives of people who use drugs, all rendered invisible, worthless, and disposable. This is not about bad choices. It's about a system designed to control and contain suffering, not end it. A system that hides its violence behind bureaucratic language, budget lines, and legal frameworks. And the worst violence? The violence we allow to continue every day. People are dying because the system is working exactly as intended. If it hasn't killed your people yet, it's only because it hasn't got to them yet. I created Detoxing the Discourse to tear this truth wide open, expose the complicity, and fight for every life discarded by the system. Because until we face this raw, unfiltered truth, nothing changes. The longer you look away, the more you become part of the problem. Health systems pretending to care, refusing to change. The deadly performance of neglect. Let's call this what it really is. Colonial, carceral, and cowardly. British Columbia's healthcare system doesn't just fail people who use drugs and Indigenous patients, it actively kills them through calculated neglect, embedded racism, and institutional cruelty. The system criminalizes us, pathologizes us, and dehumanizes us, all while patting itself on the back for doing its best. Look at the so-called solutions they offer. Safe supply programs, proven lifesavers, are strangled by red tape and bureaucrats terrified of political fallout. Decriminalization efforts are gut-punched and gutted before they even get out the gate. Hospitals, they slam the doors in our faces. Detox beds, pretty much a cruel joke with months-long waiting lists while people overdose and die waiting for a bed that never comes. Treatment centers, mostly abstinence-only, Christianized sanctuaries that shame, reject, and toss people out for not fitting into the narrow mold. Overdose response? Left to under-resourced peer teams and grassroots activists because official health authorities are too busy polishing their optics and protecting their budgets to do the work. This is not incompetence or resource scarcity. This is deliberate, strategic negligence. They want us to die. Or they could care less, because if they wanted us to live, they wouldn't demand proof of worthiness while people are dying in their hallways. The system's cruelty is an active choice, not a tragic failure. 1979, Renee Smith, Alert Bay, BC. An 11-year-old Indigenous girl, Renee Smith, died because a drunk doctor, a man so impaired by alcoholism he could barely stand, refused to do his job correctly. Diagnosed improperly, treated like she was invisible, she died slowly of untreated appendicitis. This wasn't an accident. It was textbook colonial neglect that deemed an Indigenous child less than human. Let that sink in. An 11-year-old girl left to die slowly and painfully from untreated appendicitis. Why? Because the doctor assigned to her was drunk, indifferent, and racist. He refused to properly diagnose or treat her. She screamed in agony while the system stood by, watching an Indigenous child bleed out like she was less than human. This was not neglect. It was murder. 2008, Brian Sinclair, Winnipeg, Manitoba. A double amputee Indigenous man, Brian Sinclair, waited 34 hours in a Winnipeg ER with a blocked catheter. Medical staff dismissed him as just another drunk Indian, ignored him, and left him to die. The hospital tossed the triage list aside and treated him like garbage. Death wasn't a tragedy. It was murder by neglect, racism baked into every step of his care. Every hour he waited was a deliberate act of racism, a death sentence signed by every single medical professional there that turned away from him. His death was murder through neglect. a stain on Canadian healthcare that still bleeds today. 2015, Keegan, BC. Keegan was a First Nations chess champion and student who arrived at BC Hospital after an accidental poisoning. He died because of deliberate delay in treatment, rooted in racist assumptions about drunken Indian stereotypes. The In Plain Sight report revealed that this is not an anomaly. 84% of Indigenous patients face discrimination in BC healthcare. Keegan was not a drunk Indian. He was not a failure. The system failed him deliberately and fatally. 2019-2020, David Dennis. Denied a liver transplant because of a draconian 6-month sobriety policy. David Dennis died waiting. The policy is a lethal weapon, disproportionately killing Indigenous people who use drugs by denying life-saving care. His death was a death sentence enforced by bureaucrats hiding behind evidence that doesn't actually exist. This policy isn't science or based in evidence, so it turned it into a bureaucratic weapon, killing Indigenous people who use drugs. He died waiting. It was a sanctioned execution carried out in the name of clinical guidelines. 2022, Leo Manson Sr., Nanaimo Regional General Hospital. An elder with bone cancer. Leo Manson Sr. was restrained against his will, left bruised and disoriented. Staff ignored his pleas and treated him as just a drunk Indian. The First Nations Health Authority confirmed Indigenous-specific racism runs deep in island health hospitals. Leo's suffering was not an accident. It was a predictable result of institutionalized hatred. 2024 overdose death at Nanaimo Regional Hospital, emergency restroom. In November 2024, a man known to healthcare providers at Nanaimo Regional General Hospital died alone in an emergency department washroom from an overdose. Earlier that day, he had used an unsanctioned pop-up overdose prevention site operated by the Doctors for Safer Drug policy. This clashed with the hospital's policy prohibiting illicit drug use and was reinforced by provincial regulations reinstated in April. They were shut down by the RCMP immediately and forced to move off of the property. He was left without a safe, monitored space to manage his substance dependence. Despite naloxone administration by staff, resuscitation efforts failed. Dr. Jess Wilder, an addictions medicine physician, called the death 100% preventable, emphasizing that institutional barriers and the absence of 24/7 hospital-based OPS directly contributed to his demise. The incident follows a pattern. NRGH staff and advocates who have repeatedly highlighted systemic stigma, inadequate training for overdose response, and the lack of harm reduction infrastructure. Island Health, citing safety and regulatory standards, refused to permit the unsanctioned OPS on hospital grounds, even as similar sanctioned sites, like the one at Vancouver's St. Paul's Hospital, have proven life-saving. Advocates, including bereaved families and healthcare workers, urge policymakers to prioritize evidence-based solutions over criminalization, noting that the province's stalled commitment to permanent OPS at hospitals has left vulnerable patients to suffer and die unnecessarily. This death was entirely preventable, a direct consequence of the hospital's cowardice and refusal to innovate. This is what healthcare looks like when it is laced with stigma and racism, a slow-motion genocide wearing a stethoscope. These deaths are not stories to be forgotten or statistics to be sanitized. They are indictments. They demand accountability. They demand justice. What these stories show. These are not isolated tragedies or unfortunate accidents. They are a deliberate, systematic manifestation of deep-rooted colonial violence, structural racism, and institutionalized neglect woven into the fabric of BC's healthcare system. Each story exposes a merciless system that weaponizes stigma against Indigenous peoples and people who use drugs, treating their lives as expendable, their pain as invisible. The system operates on a cold calculus, a ruthless decision-making process that defines who is deemed worthy of care and who is written off as disposable. It enforces impossible barriers, sobriety requirements, compliance checks, moral judgments that serve not to heal or protect, but to punish and erase. These deaths echo the legacy of Indian hospitals and residential schools, where Indigenous bodies were sites of containment, neglect, and extermination under the guise of care. Today, that legacy lives on in hospital wards, emergency rooms, and treatment centers, where racism and stigma are as entrenched as default protocols. The phrase healthcare here is a hollow promise. Care is conditional, withheld, unless a person fits an arbitrary and cruel set of standards. Those standards are impossible for many to meet, especially when trauma and systemic oppression shape every interaction. The system is not malfunctioning. It is functioning exactly as it is designed to. Its purpose is not to save lives, but to manage disposability, to sustain systemic control over Indigenous bodies and marginalized people. The crisis is not a failure of policy or resources. It is the success of a deliberate strategy that prioritizes social control over human dignity and survival. Recognizing this is not just critical, it is revolutionary. It demands not only acknowledgement but radical transformation. Anything less perpetuates this slow genocide under the guise of health care. The brutal reality of healthcare today in BC. The truth is harsh, but it must be named without hesitation. BC's healthcare system is a death factory operating under the veneer of care. What we witness daily is a structural war on marginalized bodies, especially Indigenous people and those who use drugs. Here's what that looks like on the ground without any sugarcoating. Detox waitlists that stretch for months are not mere bureaucratic failing. They are a death sentence. Every day spent waiting is a day closer to an overdose, a day lost to toxic street drugs that the system refuses to make safe. This delay is a weapon, wielded with cold indifference. Hospitals turning people away at their doors is no accident or overcapacity excuse. It is systemic gatekeeping that prioritizes optics over saving lives. When someone seeking help is denied care, that refusal in and of itself is an act of violence. Treatment centers enforcing abstinence like a rigid religion wield exclusion as punishment. People are thrown out, shamed, and abandoned because they don't conform to narrow, punitive models rooted in colonial and Christian ideologies, not in healing or reality. Safe supply programs proven to save lives are sabotaged and starved of funding by bureaucrats terrified of political backlash. This deliberate underfunding forces peer-led teams to scramble, patching the holes with scraps and goodwill, while officials hide behind jargon and red tape. Decriminalization laws gutted before they can save a single life reveal a political system unwilling to dismantle criminalization, preferring to maintain cycles of punishment over actual public health approaches based in evidence. Peer leadership, frontline experts with lived experience, are dismissed as tokenistic consultation, never granted real decision-making power or resources to enact meaningful change. This isn't accidental. It's a calculated silencing of the voices that know best. This is not a broken system suffering from a lack of will or money. This is a system designed to maintain control, to preserve structural violence cloaked in the language of care. Every bureaucratic hurdle, every denial of service, every failed program is a deliberate act of systemic cruelty. If the system truly wanted to save lives, it would stop demanding proof of worthiness while people were dying in its halls and alleyways. It would elevate peer leadership from a tokenism to authority. It would fund safe supply like a human right, not a political liability, but it won't, because it never has. What must change now? Enough with the half measures and empty promises. If this system ever intends to save lives rather than harvest them, it must be dismantled and rebuilt with fierce urgency, guided by those it has repeatedly failed: Indigenous peoples, people who use drugs, and peer leaders on the front lines. We are not asking for change. We are demanding it. The time for polite policy briefs and endless consultations is over. We know what works. We've known for years. What's been missing is the political will, the moral courage, and the systemic humility to actually listen to us, the ones who've lived it, survived it, and buried our people because of it. If the health system wants to stop killing us, here's where that transformation must begin. Not tomorrow, not next year, but right now. Safe supply must be universal, accessible, and embedded everywhere. Hospitals, clinics, pharmacies, shelters, and street outreach. No more pilot projects, no more hoops. If someone can get morphine after surgery, they can get a safe alternative to poison street drugs to survive. Decriminalization must be fully implemented and enforced. Not half-hearted, not symbolic, but real. We don't need more press releases. We need a legal framework that finally stops punishing people for surviving poverty, trauma, and pain with the only coping tools they've been left. No more honorary chairs, advisory tables, or photo ops. We demand decision-making power, funding, and authority, because nobody knows what works better than those who've already saved lives while the systems just stood by watching. Cultural safety training must be mandatory, not performative, and tied to real consequences. If a nurse or doctor delivers racist care, there must be accountability, not just learning opportunities, but real discipline, transparency, and reparations. Detox and treatment systems must be radically overhauled. Trauma-informed, culturally safe, non-coercive, and grounded in choice. That means no more Christianized conversion therapy disguised as care. That means respecting harm reduction as healing. That means building places people actually want to come back to, not institutions that punish them for being human. We are done waiting for those empowered to grow a conscience. The blueprints for change are here, forged by people who've been holding this broken world together with their bare hands. No more delays, no more deflections, no more excuses. The systems built to serve and protect us must be transformed into systems that actually fucking do. Systems that save, honor, and empower. And that transformation must come now, driven by those who live this crisis every day. If this system wants to be worthy of the word health, it must start by listening to those it has spent decades trying to erase. Final truth, the unvarnished reckoning. This crisis is not a glitch in the system. It is the system. A conscious, ruthless machine built to exclude, punish, and erase. Every withheld treatment, every unanswered call for help, every preventable death is not a mistake. It is a calculated act of state violence. Our healthcare systems are not broken, they are weaponized. They are battlegrounds where racism, colonialism, and addiction stigma are wielded like knives and swords, slicing away at lives society has already decided are expendable. They don't lack the resources, they lack the will to confront their own complicity, to dismantle the structures that keep us marginalized and dying. This is not neglect, this is a slow, methodical genocide, dressed in white coats and bureaucratic jargon. It is a moral collapse so deep that it stains every hallway, every waiting room, every discarded body on the streets. With every life stolen, this collapse widens, infecting the conscience of a society that refuses to see us as fully human. We will no longer be ghosts haunting the margins of a system that treats us like enemies. We demand a healthcare system forged in dignity, truth, and radical respect. One that refuses to trade human lives for political convenience or budget lines. A system rebuilt from the ground up, driven by those who live this reality, led by Indigenous voices, and accountable to our communities. We demand care without conditions, without judgment, without delay. This is not a request. This is a reckoning. Until the day care stops killing us, every overdose, every ignored scream, every stolen breath will be a call to justice, a call no one can ignore without blood on their hands. You cannot detox the discourse without burning down the lies, and I am here lighting that fire. I do not speak lightly. These words carry the weight of ancestors, of those whose voices were stolen, whose pain was silenced, whose lives were erased by systems built on colonial violence. This is more than just detoxing the discourse. This is ceremony. This is a cleansing fire, a promise to our ancestors and those yet to come. By naming these truths, we break the cycles of harm. By holding space, we open a path for healing, not just for ourselves and our loved ones, but for generations yet to come. So breathe this in. Let it root in your spirit. Let it ignite the courage to stand, to speak, to act. To everyone who walks this path with me, with heart, with fire, with unwavering purpose, who has lifted the shadows and faced the uncomfortable, who refuses to let the stories die unheard, who carries the weight of truth with courage, I raise my hands to all of you. Thank you for detoxing the discourse.